Hi, I'm Becca.
And I'm Danielle.
And I'm Erica.
And we're so excited to bring you our live virtual event to talk about the beauty and innovation of Sculptra.
We encourage you to stick around to the end of the 15-minute presentation for a live Q&A, and you can submit all your questions via the chat.
Everyone registered will be entered for a giveaway for one completely complimentary Sculptra treatment with 2 vials. And everyone in attendance tonight gets special event pricing, and that is $100 off 2 vials of Sculptra with code LUCKY100.
And right now we have a monthly special of $200 off 2 vials of Sculptra already. So with this code, it will save you an additional $100. Now this special only runs through the end of April, so call the spa this week to take advantage of the extra savings.
We're so excited to share this with you guys. Hopefully you enjoy the evening.
Sculptra is an FDA-approved injectable since 2009. It's used in over 40 countries and is the leading injectable collagen stimulator in the world. What's unique about Sculptra is that it's not a traditional filler. It stimulates your body to build its own collagen, and your results can last up to 2 years.
Sculptra has a unique formulation. It contains microparticles of poly-L-lactic acid, or PLLA. This biocompatible sugar molecule triggers a controlled response, recruiting our own fibroblasts to begin building collagen in the dermis. The PLLA is naturally broken down and eliminated as carbon dioxide, water, glucose sugar, and lactate. Sculptra gradually restores skin's inner structure and volume, creating a more youthful appearance.
Sculptra helps restore the volume we lose through the natural aging process. It improves thin skin by boosting its firmness and helps restore the natural glow. It can be used in the temple, the cheekbones, the cheek hollows, along the jawline, and the smile folds.
Most patients do beautifully with 3 treatments of Sculptra. In the first session, we typically inject 2 vials. In the second and third session, we inject 1 vial each time. We space the sessions about 1 month apart to allow time for collagen to develop. And then after the last treatment, collagen will be built continuously for 3 to 6 months and then last up to 2 years.
Sculptra is perfect for those of us with volume loss in areas that were once plump and high, such as the cheek, and in mid to deep shadows, like the smile folds. If you don't have a lot of excess skin, a Sculptra series can revolumize the face for years. If you have a history of keloids or other scarring disorders, or you have an autoimmune condition, you're probably not a great candidate for Sculptra. Consult with your provider about what's right for you. A Sculptra consultation begins with assessment of the face. We're looking for areas that have lost volume over time, such as the cheeks, the cheek hollows, the temples, jawline, and the smile folds. Placing Sculptra in the periphery of the face is very important because when we rebuild collagen in these areas, it restores fullness that looks youthful and natural. It also boosts skin tightness. Sculptra is reconstituted with sterile water to create a diluted solution that flows easily. A small amount of lidocaine is added for comfort. Each vial generates about 1.5 teaspoons of injectable PLLA. So in the first session, where we use 2 vials, we are distributing about 3 teaspoons of fluid throughout the treatment areas. We can either use a needle or sometimes a cannula to gently distribute fine amounts of PLLA. Like all injection procedures, it's important to start with clean, pristine skin. If you wear makeup, you'll need to completely wash everything off and we'll follow that with several cleaning steps. Tell your provider if you're prone to fever blisters or cold sores, so we can provide you with prescription medicine in advance. Also, to feel your best on treatment day, make sure you eat and hydrate well beforehand. The injection process can take 30 to 45 minutes. We use key injection points that allow us to gently reach multiple places so that we minimize the number of pokes to the skin. Most patients rate this between a 2 and a 5 on a 10-point scale of discomfort. Afterwards, the skin will look a bit pink and will have tiny marks from the entry points. It will also be beautifully plump. This instant plumping effect is from the sterile water that is used to reconstitute Sculptra. The body will absorb this water in 24 hours. It's a good idea, about a week before treatment, to avoid aspirin, ibuprofen, fish oil, vitamin E, and supplements that start with G. If you're more prone to bruising, taking oral Arnica Montana supplement for 2 days before and after can be very helpful. Immediately after treatment, vigorous massage is important to help further distribute and settle the product. This helps prevent lumps and bumps from uneven collagen formation. Massage is also a key part of patient aftercare. We ask our clients to follow the 5-5-5 rule. Massage for 5 minutes, 5 times a day for 5 days. This is the most important step to achieve the best results. We also highly recommend the use of a topical retinoid, which accelerates skin renewal and growth factors, especially those that stimulate collagen and supply peptides, which are the building blocks of collagen. And of course, daily sunscreen is essential to protect healing skin from pigmentation and oxidative stress, which can diminish results. With optimal aftercare, patients are loving their look at 3 months post-treatment and can maintain it for 2 years afterwards.
Thank you for joining us. Hopefully you're having a little fun and learning some new things about building your collagen.
All of our giveaway winners will be notified by phone or email tomorrow. Also, make sure you reply yes to your text message from us, and we'll contact you tomorrow to schedule a consultation and get special pricing if Sculptra is right for you.
So stick around a little bit longer. We're going to take some questions and we can talk about other ways to boost your skin and become a collagen billionaire. Put your questions in the chat now. We can't wait to hear from you.
Okay, hi everybody. Welcome to our webinar tonight. We hope you learned a little bit about Sculptra and hope that you're excited about this being a great option for you. We have been getting the best results from Sculptra at LunaSol on all of our clients and actually for myself as well. So I had my first treatment a month ago and I love it.
That's great.
I know you have some questions. We're excited to talk through those with you. Feel free to put anything in the chat box and we'll get started.
There's our first question.
All right, first question. Can you use this under your eyes?
Okay, so the tear trough or under eye area is the place we would not put Sculptra. We also do not put it in the circular muscle around the mouth. These circular muscles around the eyes and mouth, the way they move would cause the Sculptra particles to build collagen unevenly in those areas, so we avoid them. However, we've noticed that when you do Sculptra in the remainder of the face, there is a huge amount of support that comes to that mid-face, and the mid-face cheek supports the under eye. So the under eye does still benefit indirectly, don't you think?
Yes.
Yeah, it's a great question.
Another question, what is the downtime?
So you're going to have some swelling the first 24 to 48 hours. Post that, there's really not any downtime except bruising. There's always a possibility of bruising. So you want to give yourself probably a good 2 weeks before any kind of event.
Mm-hmm. Yep. Are you getting a lot of bruising with your clients with Sculptra?
I would say depends on the day, but I actually did not get any bruising myself.
Yeah.
But so Katie and Paula tag teamed.
Yeah.
And what were you?
I got bruising, but I'm a huge bruiser. Bruise with everything. So.
I've seen a few, but I found that using the cannula really helped with that.
Mm-hmm. Okay. Would this be a good option for tightening the jawline?
Oh yeah, absolutely. Because we're putting Sculptra in the periphery, the outer part of the face, the cheek, the upper axis of the jawline and the lower axis. Building collagen in this area causes a little tightening and retraction. It is not the same as surgery, but if you look at the before and afters, there's definite lift and there's a definite snatch to the jawline. It's what my friend Selena would say.
Yeah,
for sure.
And I really liked this question. Can those with Hashimoto's get Sculptra?
Well, that is an autoimmune disorder. So it would be best to have a consult with one of us because we want to know how well controlled that is. In general, we don't recommend it with certain autoimmune disorders, but that would be something good in a consult to answer.
Yeah, I agree. I think if you have a long history of an autoimmune that's well controlled and your rheumatologist or your prescribing physician is, clears you and says, yep, everything's stable. I think that's very different than if you have an undiagnosed autoimmune or something that's flaring. We wouldn't want to do Sculptra in the setting of an immune system that's really reacting.
Yeah, that's a great
question.
I have a history of keloids. Does this mean that this is not for me? So talking about scar tissue.
Scar tissue.
Keloids are an abundance of scar tissue that's actually bigger than the original injury. It represents an abnormal immune response depositing collagen. So I would not recommend Sculptra since Sculptra is stimulating collagen. I think that would be, probably a risk that I wouldn't take with Sculptra. Fortunately, there are other great treatments for lifting and tightening the face if you have keloids. And we have even treatments for keloids as well. So a great question to consult with your provider about your options.
Right. I liked this one. Can it make those of us with fuller faces look fuller? So if you already have a round shaped face, would Sculptra be a good option for you?
It's all about strategically placing the Sculptra. We're going to place it in areas where there's volume loss. Typically in the rounder areas, there's not much volume loss there. So we would probably focus, if you have, bigger cheeks, then we would focus more down in here where we hollow out in that area, or in this area, the marionette area is a good option, or nasolabial folds.
Yeah. Round faces can still get deep dynamic smile folds, and smoothing those out can just let all the beautiful fullness and contour of the face shine through. Agreed.
I think it's important to say too that it's not a thick filler, it's very thin, so it's not in general adding a lot of bulk to the face and heavy support as much as it's planting the seeds and creating your own collagen. So it has a very natural look and feel to it. So just because you have a fuller face does not necessarily mean it's not a good option.
Yeah. I really think I've never seen a patient over augmented with Sculptra.
No,
I mean, I think we've all
agree.
seen patients that got a little too much filler and it looks weird. But since Sculptra is building your own natural collagen, it's engaging a biologic process that's really part of you. And I've just never seen it go overboard. It's always seemed to look beautiful and natural. Yeah.
What is the best age for Sculptra?
I believe the FDA, it's 21 and up. And so even in your 20s, you're a good candidate for Sculptra. It helps your skin quality. And there's a lot of 20-year-olds that want more volume to their face. They're thin, they're athletic, they're runners, scarring. Yes. So it's a great option for anyone 21 and up.
It actually helps with the glow of skin as well. So even if you're in your 20s and 30s and don't have a lot of volume loss, if you're looking for glow, if you're looking for tightness, you want to maintain that youthful tightness. I've seen protocols where just a couple of vials a year are kind of like a maintenance for that age. Yeah, yeah, for you. I think it really shines for those of us 40 and up where we do have some volume loss. Then we're kind of getting the glow and some help with contour.
Yes, and as a point of reference, I had 2 vials in my cheeks, so that is 1 kit of Sculptra. And it did not add a ton of bulk, but just created a lot of balance that, looks great. How long do the results last?
Great question. So Sculptra is on label for lasting 25 months, but that just means that's how long they ran their clinical trial out. And so that's what's written into their FDA approval. We definitely have seen patients hold on to that collagen for longer than 2 years. I think it's reasonable to expect that you'll love your results for 2 years, and then you might want a maintenance or a little boost at some point. But 2 years out of one aesthetic treatment, I think is a lot of mileage. Yeah, 2 or more for sure.
And can you get just one treatment?
I would probably recommend doing the full 2 to 3 treatments for most people. You will see results with one treatment, definitely, but you probably are going to be happier with probably 2 to 3 treatments.
Yeah, I think if you're over 40, you do want the series. I think 20 to 40, you might be okay with one or 2 as that glow maintenance or glow, preventing anti-aging. But I think if you have an issue you want to tackle and improve, something you want to make better, you're going to want the series.
Yeah.
And also, we do customize everyone's treatment. So that answer is it may or may not be the right for you. 1, 2, we are going to customize that based on where you're at and what your goals are and how you've been maintaining already. So, we will see. Is Sculptra a good option for the lips?
I probably wouldn't do around the lips because that's a sphincter muscle again, and any areas of that, when you're using that motion, it could just cause more of a collection of the collagen in that area and collect it right there. So not around the mouth and not under the eyes.
Yeah. Someone's asked about side effects and the downside. I think that's a good segue.
Yeah.
Well, certainly apart from treatment side effects like swelling, a bruise, the long-term downside, there is a potential to build too much collagen in one area. That's called a nodule. That's why we really emphasize the massage, because when we really do that 5-minute massage and patients do that at home, I'm not seeing those nodules, but in the beginning, when Sculptra first came out, it was used in a more concentrated form, and I don't think massage was appreciated as much. And patients did see nodules. It's good to recognize these were small nodules of collagen, and they themselves did go away over time. So they did not see permanent issues with it. I think like anything you inject, it is possible to have a rare, serious allergic reaction to something. And if you have a lot of allergies, I would discuss that with your provider and see if you need to test it.
Okay, will the 4 vials treat all the facial areas you mentioned? And we should talk about a typical circumstance. Going back to everybody has a different dosage, and we do get the right dosage for you. But typically, 4 vials is a good treatment for most people. That's what the expectation would be.
I can get to the temples, the cheekbones, the cheek hollows, the upright jaw, and the lengthwise jaw. I can usually get it into the smile folds and oftentimes the chin. Right. And sometimes those later sessions, you might start more at this outer periphery, but sometimes those later sessions you see you need a little more. So that's where it's great to customize it. Yeah, for sure you can cover all those areas.
Right. But okay, thank you for this question, Natalie. Do you have to hold off on laser treatments before or after? Really good one.
What do you think?
I would say I would definitely hold off on laser treatments. Well, it depends on the laser, first of all, but I would probably wait 2 weeks before or 2 weeks after the treatment for lasers.
I think like any treatment, you want to give your body time to sink its metabolic energy into the treatment it just got. If you stack too many treatments all together, you're kind of dividing up your skin's resources for responding to those great therapies. So give yourself the time and the space and plan it. I think 2 weeks is very reasonable.
And I can actually speak on this too for myself. I'm a little flaky right now because I just had Fraxel 4 days ago. And I had Sculptra, my first kit, last month. So, you know, I wanted to get my laser in immediately because I've been ready. And then I am going to go back and do my next kit of Sculptra. So we're planting seeds and then lasers are fertilizing them. So they're both a great component.
Yeah. Good question.
Okay. I think we've got everything. Let me check.
Goes fast. We're almost at 7:30.
Yes, I think we've got everything. So I hope this leaves you with a lot of information on Sculptra and its amazing benefits. We look forward to seeing you in the office if you have questions, concerns. Is this a good option for you? We look forward to creating a custom plan for you. So as far as the special pricing, I did want to mention that really quick. We want you to use the code LUCKY100 to acknowledge that you've watched the webinar. You get your special exclusive, which is saving $100 on Sculptra anytime, and that can be combined with other offers. Now we have Sculptra monthly special going on right now with LunaSol, and that is $200 off a kit, which would make it $1,500. And then if you get this special with that, you save the extra $100 at $1,400 a kit. So the 2 kits is equivalent to 4 vials. 4 vials is the typical dosage. And that would be $2,800 if you take advantage of these savings before the end of April. Otherwise, remember your Lucky 100 savings and take advantage of that whenever works for you.
Yeah.
And thank you for coming and participating with us tonight.
Yeah, we'll see you soon.
Bye.